Hey guys, this is Bobby. Hey, just wanted to start this video, maybe, you know, put down how things are going and how this is my pre-surgery discussion. And my surgery is in 2 weeks for my anterior lumbar interbody fusion. Little story. I don't know how to put this, but it started about. I can actually tell the exact date. March 19th. I was in Napa with my other half and some family members, and I was walking back to the car from a restaurant in Yountville, and I was like, my hip is starting to bother me. I wonder what that's all about. So, and I remembered a while back, about 8 years ago, I had the same problem on my left side, and but it turned out I just needed a cortisone shot. Exact same symptoms. So, like my hip hurt and I had pain down my right leg. So, called my orthopedic surgeon to get an appointment, and they said, "Well, we can see you in about 6 weeks." I'm like, "Okay." So, waiting on my appointment. So I kept my life going, working out, trying to. But it got harder and harder to walk further and further. Painful. For example, I went to a baseball game here at Petco Park in San Diego to see the Padres. Parked about 5 blocks away with my buddy, and walking back to the car, man, I almost called an Uber to pick us up and take us to the car because it was so painful from my right hip down. And I mean, to the point where I was what I called stumping. My right foot just wasn't bent anymore. It was just dead. My leg from the knee down was dead. It was like a stump. That's the only word I can use to describe it. So that was on a Sunday. So the Monday morning I called, and I called my orthopedic doctor again. I'm like, "Look, guys, can you guys get me any sooner? I'm in a lot of pain. This is now sitting is starting to hurt. So now we're like, we're getting 2 weeks in after I've noticed it starting, and it's really starting to hurt. I mean, rolling over at night, it was hurting, it burned, and my foot was numb. So I called the doctor, and they're like, "Well, he can't see you until May." And then I'm like, "Okay." And so I let it go a little longer and a little longer. And then, like 2 days later, they called me and said, "Hey, by the way, your doctor, Dr. Rosen, has got to go on family emergency leave, so he can't see you till June." I'm like, "I cannot walk more than probably 50 feet. And to the mailbox and back does me in." And so she said, "Call urgent care or go to urgent care." So I went to urgent care the next day, and I'm lucky I got there before the mob shows up to urgent care, and then I was like the second person in, and they took me right away. And the doctor's talking to me. She goes, "Well, I looked at some of your old X-rays you had from a few years ago," and she goes, "Looks like you got some spacing problem in your spine, so I'm gonna do an MRI." And so she did the MRI, and I came back, and she comes back in, and after obviously she got the results of my MRI, and she's talking to me. She said, "Take off your shoe." So I take off my shoe, and she's telling me to do resistance with my toe. So my big toe on my right foot. She goes, "Resist me, resist me." And I go, "I am." She goes, "No, you're not." I go, "I am, but my toe won't move very much." She goes, "Now let's try that on the left side." Left big toe was really strong. The whole foot was strong. My toes are numb on my right foot. They tingle all the time. My side of my right leg tingles all the time. And if I bend my toes, I can't get them to go back. And she's like, she goes, "Looking at your MRI, you have the right side of your MRI, it's bone on bone between L5 and S1. And so she said, you need surgery right now, or you may not get back the nerves in your leg and your foot to work again." And I'm like, "No." She goes, "No, I'm admitting you today." I said, "No, you're not. You're not putting me in the hospital today until I get another opinion." And she goes, "Well, you'll have to sign a form saying you're refusing treatment." I go, "Well, don't have a problem with that because she kept saying it's a simple surgery. It's a simple surgery." And I'm like, "There's no such thing as a simple surgery." I had a lung biopsy about 8 years ago, and they told me that was a simple surgery, and it wasn't. I was just pretty much disabled for 2 months after that. I couldn't. It was a mess. And they always say once they open you up, they ruin you. But in that case, it was pretty bad. The lung surgery was pretty bad. So I said, I'm going to get another opinion, and then I'll let them decide. So I got several friends that are doctors and family members that are doctors, so I called all these and talked to them, and they all said, get the surgery. And so I like, okay. So called my doctor back, their office back, and like he's extended his medical family leave. He's not coming back till July. Today is June 5th right now, and I've already talked to. And I'm like, this was 2 weeks ago, and I'm like, I can't walk. This is crazy. I can't go to work. I can't go to the store. I can't do anything, and it's excruciating. It's like every time I rotate or bend that side of my body, my right side of my body, it's like fire running down my leg. And so they said, well, hold on. And so they got me in on a Friday. This was the 3rd of June. They got me in, and not the 3rd of June, a couple weeks ago. And so they got me in, and the doctor talked to me for an hour. He's fantastic, Dr. Begary at Scripps Green here in San Diego. And he went over everything very well. He showed me my MRI, and you can really see the left side of my spine is perfect, all the way down to my L5. A little bit of spacing because I'm almost 60. And then the right side all the way down until you get to L5S1. At L5S1, you can't even see the nerve. It's completely compressed between the bone. There's nothing there. You literally can't see the nerve. So I get it. I need surgery because that's what's causing the pain. And so I'm like, okay, let's do it. He goes, well, I'll have my scheduler call you sometime next week. And the problem is we need a vascular surgeon and me to schedules to line up. I'm like, okay, fine. So I expected it to be quick because I can't walk. And well, no. My surgery is now scheduled. Today is the 5th of June. It's scheduled for the 22nd of June. So I got to wait another 2 weeks. So I've been dealing with this since March. March, April, May, June. Almost 3 months to the day. I'm going to finally get the surgery. So I've been going through that. That's my little bit of history. So it's crazy. I know people can't get health care in places, but I'm like, I need an appointment. I'm selfish. I can't walk. So the insurance was a nightmare getting that approved. Back and forth, back and forth, back and forth. That's probably why the date got moved. So they're finally giving me my date. They're giving me my prep instructions for the exercises I got to do starting now before surgery. Also, I've had to get cleared by my general practitioner to have the surgery. He was the first one that had to clear me. I also have lung problems, so I had to have my pulmonologist clear me. They both have cleared me already. And now this week, Friday, I have, it's Monday, so this Friday I got an appointment with the vascular surgeon to go over the procedure that he's going to do or whatever they need. And some more x-rays. I got x-rays as well. Plenty of x-rays, a lot of x-rays and an MRI, which tell the story. You can literally see it in my back, how bad it is. But they all keep asking me, and I don't know about everybody else. That's why I'm kind of making this, because I haven't seen this in anybody else's videos that I've been following on YouTube, is that I don't have any back pain. Every doctor I've talked to, the urgent care doctor, my doctor, everybody asks you, does your back hurt? And I'm like, no, my back doesn't hurt at all. It's from the hip down. And it is staggering the amount of pain. If you turn just the right way or do the wrong thing, it will knock you down. It hurts that bad. And so I just keep seeing all these videos of people saying they have back pain problems. So, and I know I'm rambling, but I wasn't prepped to do this. So I wanted to get this out there and talk to people and get your feedback. So I will keep you guys posted. I'm going to plan to do this a little bit, and then when I have surgery and a little bit after, see my recovery, because I've been really helpful with the people. I've seen their videos that they've talked about their recovery and how everything they went through before, everything they went through during, and the follow-ups weeks or so after. So that really helps me, helps anybody just not be afraid, because I hate surgery. I've had a lot of surgery: knee, hip, my cortisone shot in my hip, bicep tendon torn off, lung surgery. It's a mess. So I'm not a fan of surgery. I'm not looking forward to it, but it's got to get done. So I will keep you guys up to date. Again, this is Bobby. This is my L5S1 Fusion journey. Catch you later, guys.